Yeah, so the next we have is Dr. Divya Dangeti. Is she here? Yeah. Severe ocular ischemic syndrome with NVG in a case with Takasio arteritis.
So good evening, everyone. So today I will be presenting on a case of severe ocular ischemic syndrome with neovascular glaucoma in a case with Takasio arteritis. So here is a 32-year-old female hailing from Maharashtra, came with diminution of vision since 6 months. And it was associated with photophobia, redness, and watering since 1 month, which is not associated with any other features. Prior to this, she consulted locally for 6 months ago, where she was diagnosed as neovascular glaucoma with baseline intraocular pressures of 24 in the right eye and 26 millimeters of mercury in the left eye, and prescribed on 2 anti-glaucoma medications. But she discontinued after 2 months. And a year ago, in the past, she was consulted for the severe headache at the neurophysician, where they had advised for MRI brain. And it showed old lacunar infarct, but they did not treat it for it. But the patient had recurrent and persistent headaches, so the physicians had advised on antidepressants, but the treatment was discontinued by the patient by self. But patient had no other significant history except that she was treated for the hypertension. On examination, systemically patient is thin-built and undernourished. An ocular examination, both eyes showed mild congestion, mild corneal haze in both eyes with neovasculars on the iris. In the right eye, the pupil was round, regular, and sluggishly reacting, and left eye was dilated. So here is the pictures showing of left eye with pupil is dilated and without any medications. It is not a pharmacological dilatation, it's a normal which patient presented to us, which showed mild congestion and new vessels on the iris. And on intraocular pressures were 8 and 9 noted without any anti-glaucoma medications, and gonioscopy showed sinically closed angles in both eyes. Fundus examination showed new vessels on the disc with narrowed and attenuated vessels in both eyes, where the arteries were faintly seen compared to the veins. And with this, the differentials we had at this point of time were these, but to rule out whether what is the cause for the new vessels, and actually which we are dealing, is it a neovascular glaucoma or not. So here we don't have any history of diabetes or no features of retinal vein occlusion or Coats retinopathy. And to rule out ocular ischemic syndrome, we have referred the patient to physician, where she was noted to have recurrent headaches associated with feeble pulses at the upper extremities with normal pulse in the lower limb, and severe myalgias were noted for the patient in the past, with low blood pressure noted in the upper extremities compared to the lower extremities, and carotid bruit, and lungs which were normal, and in blood investigations noted raised platelet count, and CT showed clinically diagnosis of Takasio arteritis, where severe narrowing of the blood vessels of the large arteries were noted. So the final diagnosis of both eyes ocular ischemic syndrome was made with neovascular glaucoma secondary to small vessel involvement in Takasio arteritis. It is actually chronic granulomatous inflammatory disease which involves large vessels seen commonly in young individuals, more commonly in females. And this attenuation of the blood vessels lead to ischemic of the entire organs in the body, and which will not treated at appropriate time. It can even lead to further severe complications of the individuals. So these are the most uncommonly recognized features which has to be treated at appropriate time, which if not, these features have been diagnosed to be treated at appropriate time. So the management includes ocular, pan-retinal photocoagulation, and systemically oral steroids. So on follow-up, patient was a little bit better, but she developed cataract over a period of time with normal pressures without any anti-glaucoma medications. So as we know, eye is a window for multiple diseases in the body. So we have to rule out the disease, and appropriate early diagnosis has to be made in the initial phase to prevent severe vascular damage, and has to be treated by immunosuppressants to prevent severe damage of the individual.
Thank you, Divya. Thank you, Divya. That was well presented and timely reminder that we should not be only looking at the eye, but looking at the body as a whole. But where is the glaucoma?
Yes, that is the actual thing, because the ocular ischemia is so severe that ocular perfusion is so much reduced. The aqueous, there is no raised pressures in this. So this is not actually a neovascular glaucoma, but we have to treat the systemic condition than the eye.
Agreed. But where is the glaucoma?
Yeah.
Pressures are normal.
Yes.
You've not mentioned this. You talked about NVG.
Yes.
But you know, there are no changes in the disc.
Yes.
So has not developed glaucoma yet.
Yeah. But
May not develop glaucoma in future either. We don't know.
Yeah, actually, her previous baseline features elsewhere which were diagnosed showed borderline little bit higher pressures, but because of severity of this systemic condition, her blood vessels were narrowed so much, the ischemia is so severe. So because the carotid blood vessels were so narrowed.
How does that affect IOP?
Because of the secretory phenomenon.
Are you convinced?
Okay. Because these vasculitis affect the large vessels, which affects the common carotids. If you show the CT of the
No, that's okay. That's, you know, that is something we are not contradicting at all.
Yes.
What we
So
are saying is, you said it's a case of NVG.
Yes.
We've not seen glaucoma yet in this.
Yes.
Okay. Thank you.
Thank you.
I want to highlight one point, that once we want to look for the NVI, we should look in an undilated eye.
No, that came as a dilatation.
No.
No, that's right, but we should not dilate, I mean to say, we should not dilate the pupil. We should not dilate the pupil to see NVI.
Yes. But this was patient presented with normally dilated pupil.
But in early cases,
Pharmacologically dilated.
yes, I mean to that we should not pharmacologically dilate
Yes.
the pupil to see the NVI.
Yes.
Because it is more pronounced in undilated pupil
Yes.
than in dilated pupil. Next I request Dr. Indu Pawani to, our topic is when it is not glaucoma, decoding the mysterious field effects.